In this video, we're going to look at some of the effects of inspiration and expiration on a CT scan and the way things project in the lungs. These are two scans of the same patient done at different time intervals with slightly different degrees of inspiration. It is often difficult to get the patient to breathe exactly at the same level despite extensive efforts. I've inverted the image so you can see the anatomical structure slightly better. The lung is quite a dynamic structure, unlike other solid organs, where it moves smoothly against the chest wall and other structures when the patient breathes in or out. The movement is more conspicuous at the bases when compared with the apices. So when we go to the top of the lung, this part of the lung moves much less than the bottom part of the lung. So we have linked this scan around the mid-level, where you can see the ascending and descending thoracic aorta and the pulmonary trunk at this level matched in detail. And you can see that as we grow towards the mid portion of the lung, the two positions of the lung nodules and the mid area of the thorax only differs very slightly. So you can see it on the older scan at this point, and you have to go only slightly lower where it can be visible on the next scan, which has got greater inspiration. But when we go further inferiorly, you have greater movement, and you can see on the next nodule, which is here, you have to go several slices before you catch it on the next scan. It becomes even worse as you grow even further down, and you can see that this nodule here is invisible at exactly the same vertebral level, and you have to go many vertebrae below before that comes into effect. It's important to bear this in mind when interpreting CT scans. Finally, when you go to the extreme base, you can see that the lung disappears here, and there's a large part of lung left at the base where due to greater inspiration, and here we have at approximately T12 level where the liver is occupying most of the image, where you have to go down to several vertebrae below, where you can still see lung occupying that area. So in summary, the lung moves less at the apices and greater at the bases, and your index lesions can considerably move up and down at the basal regions compared with the apical regions.